Ikigai. Better living through logotherapy. A few key ideas. We don't create the meaning of our life. As Sartre claimed, we discover it. We each have a unique reason for being, which can be adjusted or transformed many times over the years. Just as worry often brings about precisely the thing that was feared, excessive attention to a desire, or hyperintention can keep that desire from being fulfilled. Humor can help break negative cycles and reduce anxiety. We all have the capacity to do noble or terrible things. The side of the equation we end up on depends on our decisions, not on the condition in which we find ourselves. In the page that follow, we will look at 4 cases from Frankl's own practice, in order to better understand the search for meaning and purpose. Case study: Viktor Frankl. In German concentration camps, as in those that would later be built in Japan and Korea, psychiatrists confirmed that the prisoners with the greatest chance of survival were those who had things they wanted to accomplish outside the camp, those who felt a strong need to get out of there alive. This was true of Frankl, who, after being released and successfully developing the school of logotherapy, realized he had been the first patient of his own practice. Frankl had a goal to achieve, and it made him persevere. He arrived at Auschwitz carrying a manuscript that contained all the theories and the research he had compiled over the course of his career, ready for publication. When it was confiscated, he felt compelled to write it all over again, and that need drove him and gave his life meaning. Amid the constant horror and depth of the concentration camp, so much so that over the years, and especially when he fell ill with typhus, he would jot down fragments and the key words from the lost work on any scrap of paper he found. Case study: The American Diplomat. An important North American diplomat went to Frankl to pick up where he fell off with a course of treatment he had started 5 years earlier in the United States. When Frankl asked him why he had started therapy in the first place, the diplomat answered that he hated his job and his country's international policy, which he had to follow and enforce. His American psychoanalyst, whom he had been seeing for years, insisted he make peace with his father so that his government and his job, both representations of the paternal figure, would seem less disagreeable. Frankl, however, showed him in just a few sessions that his frustration was due to the fact that he wanted to pursue a different career, and the diplomat concluded his treatment with that idea in mind. 5 years later, the former diplomat informed Frankl that he had been working during that time in a different profession and that he was happy. In Frankl's view, the man not only didn't need all those years of physical analysis, he also couldn't even really be considered a patient in need of therapy. He was simply someone in search of a new life purpose. As soon as he found it, his life took on deeper meaning. Case study: The Suicidal Mother. The mother of a boy who had died at age 11 was admitted to Frankl's clinic after she tried to kill herself and her other son. It was this other son, paralyzed since birth, who kept her from carrying out her plan. He did believe his life and had purpose, and that if his mother killed them both, it would keep him from achieving his goals. The woman shared her story in a group session. To help her, Frankel asked another woman to imagine a hypothetical situation in which she lay on her deathbed, old and wealthy but childless. The woman insisted that in that case she would have felt her life had been a failure. When the suicidal mother was asked to perform the same exercise, imagining herself on her deathbed, she looked back and realized that she had done everything in her power for her children, for both of them. She had given her paralyzed son a good life, and he had turned into a kind, reasonably happy person. To this she added, crying, "As for myself, I can look back peacefully on my life, for I can say my life was full of meaning, and I have tried hard to live it fully. I have done my best. I have done my best for my son. My life was not failure." In this way, by imagining herself on her deathbed and looking back, the suicidal mother found that meaning that, though she was not aware of it, her life already had. Case study: The grief-stricken doctor. An elderly doctor, unable to overcome the deep depression into which he had fallen after the death of his wife 2 years earlier, went to Frankel for help. Instead of giving him advice or analyzing his condition, Frankel asked him what would have happened if he had been the one who died first. The doctor, horrified, answered that it would have been terrible for his poor wife, that she would have suffered tremendously. To which Frankel responded, "You see, doctor, you have spared her all that suffering, but the price you have to pay for this to survive and mourn her." The doctor didn't say another word. He left Frankel's office in peace after taking the therapist's hand in his own. He was able to tolerate the pain in place of his beloved wife. His life had been given a purpose. Morita therapy. In the same decade that logotherapy came into being, a few years earlier, in fact, Shoma Morita created his own purpose-centered therapy in Japan. It proved to be effective in the treatment of neurosis, obsessive-compulsive disorder, and post-traumatic stress. In addition to being psychotherapist, Shoma Morita was Zen Buddhist, and his therapy left a lasting spiritual mark on Japan. Many Western forms of therapy focus on controlling or modifying the patient's emotions. In the West, we tend to believe that what we think influences how we feel, which in turn influences how we act. In contrast, Morita therapy focuses on teaching patients to accept their emotions without trying to control them, since their feelings will change as a result of their actions. In addition to accepting the patient's emotions, Morita therapy seeks to create new emotions on the basis of actions. According to Morita, these emotions are learned through experience and repetition. Morita therapy isn't meant to eliminate symptoms. Instead, it teaches us to accept our desires, anxieties, fears, and worries and let them go. As Morita writes in his book Morita Therapy and the True Nature of Anxiety-Based Disorders, in feelings it is best to be wealthy and generous. Morita explained the idea of letting go of negative feelings with the following fable. A donkey that is tied to be a post by a rope will keep walking around the post in an attempt to free itself, only to become more immobilized and attached to the post. The same thing applies to people with obsessive thinking who become more trapped in their own suffering when they try to escape from their fears and discomfort. The basic principles of Morita therapy. The first one, accept your feelings. If we have obsessive thoughts, we should not try to control them or get rid of them. If we do, they become more intense. Regarding human emotions, the Zen master would say, if we try to get rid of one wave with another, we end up with an infinite sea. We don't create our feelings, they simply come to us, and we have to accept them. The trick is welcoming them. Morita likened emotions to the weather. We can't predict or control them, we can only observe them. To this point, he often quoted the Vietnamese monk Thich Nhat Hanh, who would say, "Hello, Salud. How are you today? Come sit with me, and I will care for you." The second one, do what you should be doing. We shouldn't focus on eliminating symptoms, because recovery will come on its own. We should focus instead on the present moment. And if we are suffering, on accepting that suffering. Above all, we should avoid intellectualizing the situation. The therapist's mission is to develop the patient's character, so he or she can face any situation, and the character is grounded in the things we do. Morita therapy doesn't offer its patients explanations, but rather allows them to learn from their actions and activities. It doesn't tell you how to meditate or how to keep a diary the way Western therapies do. It is up to the patient to make discoveries through experience. The third one, discover your life's purpose. We can't control our emotions, but we can take charge of our actions every day. This is why we should have a clear sense of our purpose and always keep Morita's mantra in mind. What do we need to be doing right now? What action should be taken? The key to achieving this is having dared to look inside yourself to find your Ikigai. The four phases of Morita therapy. Morita's original treatment, which lasts 15 to 21 days, consists of the following stages. The first one, isolation and rest, 5 to 7 days. During the first week of treatment, the patient rests in a room without any external stimuli. No television, books, family, friends, or speaking. All the patient has is his thoughts. He lies down for most of the day and is visited regularly by the therapist, who tries to avoid interacting with him as much as possible. The therapist simply advises the patient to continue observing the rise and the fall of his emotions as he lies there. When the patient gets bored and wants to start doing things again, he is ready to move on to the next stage of therapy. The second one, light occupational therapy, 5 to 7 days. In this stage, the patient performs repetitive tasks in silence. One of these is keeping a diary about his thoughts and feelings. The patient goes outside after a week of being shut in, takes walks in nature, and does breathing exercise. He also starts doing simple activities such as gardening, drawing, or painting. During this stage, the patient is still not allowed to talk to anyone, except the therapist. The third one, occupational therapy, 5 to 7 days. In this stage, the patient performs tasks that require physical movement. Dr. Morita liked to take his patients to the mountains to chop wood. in addition to physical tasks. The patient is also immersed in other activities, such as writing, painting, or making ceramics. The patient can speak with others at this stage, but only about the tasks at hand. The first one is the return to social life and the real world. The patient leaves the hospital and reintroduced to social life, but maintains the practice of meditation and the occupational therapy developed during treatment. The idea is to re-enter society as new person, with a sense of purpose, and without being controlled by social or emotional pressures. Nikan meditation. Morita was a great Zen master of Nikan introspective meditation. Much of his therapy draws on his knowledge and mastery of this school, which centers on three questions the individual must ask him or herself. The first one, what I have received from person X. The second one, what have I given to person X. The third one, what problems have I caused person X. Through these reflections, we stop identifying others as the cause of your problems and deepen our own sense of responsibility. As Morita said, if you are angry and want to fight, think about it for 3 days before coming to blows. After 3 days, the intense desire to fight will pass on its own. And now, Ikigai. Logotherapy and the Morita therapy are both grounded in a personal, unique experience that you can access without therapists or spiritual retreats. The mission of finding your Ikigai, your existential fuel. Once you find it, it's only a matter of having the courage and making the effort to stay on the right path. In the following chapters, we will take a look at the basic tools you will need to get moving along that path, finding flow in the tasks you have chosen to do, eating in a balanced and mindful way, doing a low intensity exercise, and learning not to give in when difficulties arise. In order to do this, you have to accept that world, like the people who live in it, is imperfect, but that it is still full of opportunities for growth and achievement. Are you ready to throw yourself into your passion as if it were the most important thing in the world?